You're still watching TVC Breakfast. Now, the Nigerian Association of Resident Doctors, NARD, and the Nursing and Midwife Council of Nigeria have renewed calls for hospitals to treat gunshot victims immediately without demanding police reports. Now, according to the Compulsory Treatment and Care for Victims of Gunshot Wounds Act 2017, it mandates that hospitals, both public and private, must provide immediate medical treatment to gunshot victims before any police documentation. Now, NARD President Dr. Mohammed Suleiman described the refusal to treat such victims as unacceptable, citing the law and the Federal Ministry of Health Directive on Emergency Response. He added that some doctors may be unaware of the law, noting that NARD continues to educate its members. Now, joining us in the studio for this conversation is medical doctor Tui Mebawandu. Thank you so much for joining us.
Good morning.
Good morning. Nice it's good to have you. Let me give you another handshake for this conversation. This is a very pertinent topic that, we bring and we talk about it over and over again. We've seen so many cases of people dying, not because they were not rushed to the hospital on time, but because one doctor is somewhere just asking, bring a police report, bring your identity. And at the end of the day, we look at it, what is the most important thing? It is to save a life. And as a doctor, I'm sure that you know that to save a life matters rather than checking those documentations. But we've spoken about this a whole lot of times. Do you think that we're finally getting to the point where it gets implemented?
We've not gotten to the point. We're still talking about it. The whole spectrum is how to operationalize the law. The law itself, if you look at it, you wonder really were the medical people consulted with the law, because you see it's quite very punitive. In the sense that there's a punishment for you if you're standing by and you're not helping gunshot victims. There's a punishment for the doctors that refuses to attend. That's just punishment for the health professional about the law. And when you talk about punishment, everybody is punishment averse. You want to stay back a bit. But 10 years ago, we were on this. We're talking about how to operationalize on this same television station, how to operationalize these directives. Because at the end of the day, the gunshot injuries, no gunshot injuries are the same, okay? Some could be accidental discharge, some could be a result of violence, armed robbery, fighting somewhere, even knife injury. And then the circumstance leading to that gunshot injury is not just at the hospital, okay? Because number one, if you have gangs fighting, and then they ended up in hospital somehow, and then you have to do treatment, okay? The question is that who is protecting the doctors, or the hospital from being attacked by this group? Now, the second thing about the law says that, okay, you know what, you must report within 2 hours of treating such a person. People say, I will challenge you now, dial the emergency number. Let's see whether it's going to work. Dial police emergency number. So you make law without providing such, platform to help ease such a communication. And then people, we seem to assume that every part of Nigeria has what's it called, a police station, or very close to us, or the network is very good. But how do you now communicate in remote areas to the police station? Okay, when you are dealing with banditry, kidnapping, all sorts of violence, how do we really deal with that? Do we situate the doctor and or the hospital and raise them as the victim of making people die? And I can tell you, I work in public system for 21 years, okay? I can tell you a situation whereby, violent people enter the hospital when you are treating them and, fault everybody. Yeah. So I mean, and then the critical aspect is this: have you made this treatment of gunshot victim easy for doctors? Because now, gunshot may enter the tummy and you have to really do procedure. And then you are incurring cost. Somebody say we are supposed to save life now. Okay. So how do you deal with that?
So the cry I'm hearing you cry is government support of the medical sector when it comes to things like this. Yes, for this thing that NARD is saying right now, we have to have some kind of intervention fund, right? That will pay for those emergency procedures when they come. And one thing that baffles me is, how come there's a law that says report this, and then there's nothing done to fix infrastructure that will make that report easy? Why is what is going on? Is it that the medical practitioners did not have enough what I call nuisance value on government to ensure that this thing happens?
Well, let me tell you, I have been at a point when national resident doctors were actually, you know, a potent force to push democratic reforms in this country. But as we go on, things tend to really attenuate a bit and people just get to calm down. So in reality, you are too busy trying to focus on saving life than having to run after her to provide infrastructure and talk to government about so many things. But it's okay. Now, for me, the greater point is actually for us to sit down and look at how to operationalize all these things. Now, if gangsters are fighting their war and you know, one of them is brought to the hospital and needs treatment, is police going to give me protection? Okay, until that person goes away. Now, if you're a doctor in a remote area and then you know your phone, your network went down, can you still be spared the 500,000 fine the government imposing on you? Okay, so if for instance I have done all these treatments and then I say that my money is this amount of money, can insurance underwrite all those things and cover? So there are a lot of things in this thing. It's not just about instruction, go and start treating. We know doctors honestly know that they have to, you know, respond appropriately. The only thing that is stopping them from responding is the fear. You know, the fear not just that the police will arrest them or prosecute them, they can always deal with that. The fear that this is a violent situation. You have a country, 6.2 million small weapon and arms in the country, 6.2 million. The police and army, everybody has less than 600,000. And the civilian has 6.2 million. No, now I want to go back and tell you so that we situate the discussion appropriately. 6.2 million small weapons and light arms in Nigeria, in the hands of civilians. They're not to eradicate mosquitoes now.
Are we saying?
So now, the security people, less than 600,000. Okay, now, that is there. We have insecurity, we have violence, we have everything going on. So, I mean, when you see a nation like that, of course, America has about 7.1 per 1,000 people, injuries, I mean, gunshot injury. Nigeria also we cannot really document it because it's underreported.
But it's not anywhere close to that of America because America is more like on a daily. But now we've had the NMA, you know, spoke to this. The NARD also spoke to this, that doctors should always treat patients. We know that Ondo State government, you know, at the point said that those victim of gunshot, anyone under emergency, will be taken care of by the state government, you know, within 48 hours. So hospitals should attend to them. So whoever fails to do, you know, to attend to gunshot victims or anyone who has emergencies, who should bear the cost? No, not just bear the cost. Who should be punished for not doing the right thing?
Well, it is, you know, when you create a scenario for people to work and it's working, you don't start thinking, then you can start thinking about punishment. But the starting point is that, like I've initiated, how have we dealt with all those things? But if you have a situation whereby, you know, a state government says, I'm going to pay, or an insurance company says that anywhere you see gunshot injury, I'm underwriting, or police say that, don't worry, you know, whatever is the cost, we are committed to paying the money, okay, and giving you protection. You will say that nobody with gunshot injury, you know, will run into trouble. And then the other point we're missing is that there are clear cases of capacity, okay? Now, I remember the lady that was shot under the Ajah Bridge, you know. Indeed, you'll be surprised those people don't really have capacity because gunshot injury is not a, you know, just one. Depending on the place, it could actually, it may require a multi-specialist to deal with this, to deal with that, and then you are looking for blood transfusion, you cannot get blood transfusion, transportation, there are potholes everywhere. Let us I
hear you talk, and I'm scared because of some of the things you're saying, because it's scary. Because think about the fact that something can happen to someone and you get to hospital and there are reasons why you'll not be taken care of. Let's talk about Blessing Akpan. I don't know if you remember the story. The NSCD, they were asking her for the identity card before they treated her. She was stabbed and she passed away just because the hospital was asking for her identity card. Yes, we understand that there are fears in terms of security and all of that, but how can we now finally eradicate this to make sure that these people are taken care of, because we ourselves, we cannot keep losing more lives. It could be anybody. Sometimes we just speak about it. It could be your relative, it could be anybody. And it's now when it's your person, you are now very agitated. But as at now, what are the things that can be done? We talk about capacity. We see that right now a lot of doctors are trying to travel abroad. Like, how can we make Nigeria a better place in terms of our healthcare for us to know that we even have the capacity first?
We are talking of a whole day discussion. But again, it's an appeal to doctors, and we have to keep talking about it. If I were to be the head of police, simply, I would say those instructions, not just going on TV, radio. It's okay. A clear-cut pamphlet or what they call a poster that we can put everywhere. That's right. It's safe for gunshot. I mean, it's a visual thing, it's a communication, and then be assured you have a number that is functioning that the doctors can call. Put the number on those posters. How many hospitals do you have in Nigeria now? I mean, million hospitals. So then put a number that can function on those posters. I will appeal to doctors to do all they can, and then the other thing is the referral system, because it's not so easy to treat all gunshot injury. And then we have to create a referral system that can attend to all these things. Even in Lagos.
By referral system, you mean when someone...
When the injury goes beyond a private hospital, the first care, whether a primary health care center or a private hospital that is supposed to attend to it, okay, you need a multi-specialist treatment, and then you have to do a referral. There's no working ambulance system that will pick somebody up and go and drop in Lutz now.
When they get there, some hospitals also reject.
Most hospitals.
No. Where's your statistics? No. Hold on. Calm down. You see, the thing is that the Zeigarnik effect says that when you present a circle that is 9/10 complete, the focus is on the 1/10 that is not complete. It happens even in most of our discussion. I can tell you that doctors, majority, will attend to victims. But when that 1% refuses to do that, it becomes a focus. It's something that now trend. I can tell you, because me, I've never done anything apart from health all my life. You understand? I can tell you that 9 out of 10 cases, doctors will rise up. Because it's an emotional investment. When you look at somebody bleeding and you are
it's your call, humanity first.
You see, we
didn't create humanity. Let's leave humanity alone. But it's an emotional thing that you have to do.
Humanity. Humanity first. Like a doctor.
You will understand our sentiments. We just lost a colleague because of something like this. She was taken to the hospital and they said, "Look, if we don't get your ID, we won't treat," and she passed on.
You wonder why.
Sometimes
it's not even just ID, sometimes money as well.
Those kind of stories makes me wonder.
It's painful. Sir, respected media person you are, all of you.
Yeah.
But do you know the most painful thing for a medical doctor to be watching his patient die? It's extreme. Sometimes you have to go and do a PTSD kind of treatment. You have to wonder, what had I done? What did I do? What am I supposed to do?
Okay.
But that's at variance with what some people say about nurses. Some nurses don't care. They just talk to you like, you're just...
They don't even have
well, he's talking about...
It must be cultural, because and the experiential, some of these things really... But I can tell you, for everyone that is nonchalant, I can tell you there are
10 or 15.
9 that's
out of 10
good. That's actually saying that, okay, what can we do, what do we run on? But I was just trying to give a situation where somebody went all the way to hospital to get treatment from 7 a.m. and didn't leave until 4. What happened? Because there are issues. There are issues. So please, I also want to lend my voice to this ongoing discussion. Doctors, nurses, health workers, please treat not just gunshot injury, anybody in their situation.
Exactly.
I think that does it.
I know some of us, we have to pay, some prices in terms of loss of fund, being beaten. In the Massive Children's Hospital, those when we're working, they've turned our clothes now. So we didn't stop treating people because
Amazing.
of that.
Dr. Tui, it's so sad that we have to end the conversation here.
You always end my conversation.
It's from directives. I'm working on the authority. But, I wish we could go on and on with this conversation. But I loved what you just said. At the end of the day, we need to make sure that we treat every person, not talk about money first. When the person is healed, you talk about money. But saving a life is very important. Yes.